While the African American community comprises only 13% of the U.S. population, they represent nearly 50% of new HIV infections in the country. Stigma and lack of resources are challenges that perpetuate these figures. The National HIV/AIDS Strategy charges us to focus efforts and resources to educate, test, and link clients to care in communities of color, and Lead the Way at UC San Diego looks to answer this call to action.
I began Lead the Way to try and destigmatize HIV testing in central San Diego, to make people aware that routine HIV testing is something that every member of our community should participate in to try and reduce HIV transmission and link people into care who need those services. We were very successful in central San Diego, and I look forward to the opportunity to bring Lead the Way to southeast San Diego.
My name is Wanda, and I've been positive for 20 plus years. It's so important that you know your status and the status of your partner.
Statistics show that there's a huge rise in HIV diagnosis concerning people of color.
And we need to see more HIV testing here in southeast San Diego.
And the earlier diagnosed, the better.
It is important to recognize that African American women are significantly impacted in the United States. The Center for Disease Control estimates that 64% of HIV-infected women are African American.
We need more HIV resources in southeast San Diego.
Lead the Way would bring an amazing resource to southeast San Diego and would help researchers learn more about HIV prevention, testing, and linkage to care services in this underserved community.
Bringing Lead the Way to southeastern San Diego is the next logical step in the expansion of resources to communities of color. By offering the early test and linking newly infected clients to care will both improve the life of the HIV-positive individual and reduce risk to the community. UC San Diego is uniquely qualified to address education gaps through HIV University, link clients to care through the Antiviral Research Center or local community providers, and also to use the data and blood samples obtained through Lead the Way to further research, including transmission patterns, early acute infection, and cure and vaccine studies.
Because we have faith.
Because we are empowered. Because we are united.
Because we have the resources and because we care, we would like to lead the way.
Come on, talk to me. You can see what's going on.